you open your eyes. And before any thought has formed, before you have remembered what day it is, or what you need to do, or what happened yesterday, before any of that, the first thing you feel is your mouth. Dry. Completely dry. The kind of dry that does not feel like ordinary morning thirst. Your tongue feels thick and heavy against the roof of your mouth. Your lips are cracked at the corners. Your throat has a rawness to it, a scratchiness, like you spent the night breathing through sandpaper, and you reach for water, if you are smart enough to keep it on your nightstand, and you drink, and for a moment it helps, and then you get up and brush your teeth and make coffee, and the day begins, and you forget about it entirely. Until tomorrow morning, when it happens again, and the morning after that. I need you to stop doing that. I need you to stop forgetting about it. Because what I am going to tell you in the next several minutes is something that took some of my patients years, in a few cases, decades, to find out, and by the time they found out, the window for early intervention had narrowed considerably. My name is Dr. Clarence Martin. I have been in medical practice for over 20 years. In that time, I have sat across from patients whose serious health problems announced themselves first as something they dismissed as trivial. A small symptom, an easy-to-ignore symptom. A symptom that everyone assumes is normal because everyone they know seems to experience it. Waking up with a dry mouth is one of those symptoms. It is not normal. It is common. There is a critical difference between those two words, but it is not normal. And depending on what is causing it in your specific case, it can be the earliest visible sign of conditions ranging from manageable and correctable to serious and progressive. Today, I am going to walk you through exactly what your body is communicating when you wake up this way, what the possible causes are, how to distinguish between the ones that require only a simple lifestyle adjustment and the ones that require you to pick up the phone and call your doctor, and what you can do, starting tonight, to begin addressing it. First, let me explain what saliva actually is and what it is doing while you sleep, because most people have no idea, and understanding this makes everything else I am going to tell you make more sense. Saliva is not just water. It is a complex biological fluid produced by 3 pairs of major glands: the parotid glands near your ears, the submandibular glands under your jaw, and the sublingual glands under your tongue, plus hundreds of smaller minor glands distributed throughout your mouth. On a normal day, a healthy adult produces between 1 and 1.5 liters of saliva. That is a significant volume of a carefully composed fluid that your body is manufacturing continuously. What is in it matters. Saliva contains enzymes that begin digesting food before it even reaches your stomach. It contains antimicrobial proteins, lysozyme, lactoferrin, immunoglobulin A, that actively fight bacteria and fungi in your mouth. It contains bicarbonate that neutralizes acids produced by bacteria and the foods you eat, protecting your tooth enamel. It contains proteins that help remineralize areas of your teeth where enamel has begun to soften. Your saliva is, in other words, your mouth's immune system, its cleaning crew, its repair mechanism, and its first line of digestive processing, all in one fluid. Now, saliva production drops significantly during sleep. This is normal and expected. Your body shifts into a lower maintenance mode during sleep, and saliva flow decreases as part of that shift. Some degree of morning mouth dryness, mild, resolving quickly with a few sips of water, is within the range of normal physiology. What is not within the range of normal physiology is waking up with severe dryness that persists, that affects how you speak and swallow, that is accompanied by cracked lips and a raw throat, that has been happening consistently for weeks or months. That is your body telling you that the nighttime reduction in saliva production is being compounded by something else, something that deserves your attention. Let me walk you through what that something else might be. Cause, number 1, mouth breathing. During sleep. This is the most common cause of morning dry mouth, and it is also, in my experience, the one that most people are most surprised to learn they are doing. Because you cannot observe yourself sleeping. You do not know how you are breathing unless someone tells you or unless you start paying attention to the evidence your body leaves behind each morning. When you breathe through your mouth during sleep, the airflow across your oral mucosa, the moist tissue lining your mouth, causes rapid evaporation of whatever saliva is present. The drying effect of 8 hours of mouth breathing is significant. The cracked lips, the sandpaper tongue, the raw throat. These are the classic presentation of a mouth breather waking up. But here is what matters. Chronic mouth breathing during sleep is frequently not a habit or a preference. It is a symptom of something obstructing nasal airflow. Nasal congestion from allergies, seasonal or perennial, is one of the most common culprits. A deviated nasal septum, which many people have without knowing it, can significantly reduce airflow through one or both nasal passages, forcing the body to compensate through the mouth. Nasal polyps, enlarged turbinates, chronic sinusitis, all of these create the same problem. Your body wants to breathe through your nose. The nose filters air, humidifies it, warms it, and provides resistance that supports healthy lung function. When something is obstructing that pathway, the body defaults to mouth breathing as a workaround. The important point is this. If your morning dry mouth is caused by mouth breathing due to nasal obstruction, treating the obstruction treats the symptom. An allergist or an ear, nose, and throat specialist can identify and address the specific cause. This is frequently a correctable problem. If your nasal passages are clear and you are still breathing through your mouth, it is worth discussing with your doctor because there are structural and neuromuscular factors that contribute to habitual mouth breathing that can also be addressed. Cause number 2. Sleep apnea. This is the cause I want to spend the most time on because it is the one with the most significant health implications and the one that is most frequently undiagnosed for years while the consequences accumulate silently. Obstructive sleep apnea is a condition in which the soft tissue of the upper airway, the soft palate, the uvula, the base of the tongue, collapses repeatedly during sleep, partially or completely blocking the airway. Each time the airway collapses, breathing stops. The oxygen level in your blood drops. Your brain registers the drop and sends an emergency signal that briefly rouses you from deep sleep. Not enough to wake you fully in most cases, but enough to restore muscle tone in the airway and resume breathing. This cycle can happen 5 times per hour in mild apnea. It can happen 30, 40, 50, or more times per hour in severe apnea. The person experiencing it almost never knows it is happening. Their bed partner often does. The characteristic pattern of loud snoring, a pause in breathing, a gasp or snort, then snoring again is recognizable to anyone who has shared a bed with someone who has undiagnosed sleep apnea. But the person themselves often presents to their doctor reporting only that they wake up tired no matter how long they sleep, that they have morning headaches, that they fall asleep easily during the day, and, here is the relevant symptom, that they wake up every morning with a severely dry mouth and a raw throat. The dry mouth in sleep apnea comes from 2 sources. The repeated airway obstruction causes the sleeper to breathe through the mouth as the body attempts to compensate, and the arousals from sleep, even the microarousals that are not consciously remembered, activate the sympathetic nervous system, which suppresses saliva production. Why does this matter so much? Because untreated sleep apnea is not simply an inconvenient sleep disorder. The research on its long-term health consequences is sobering. People with untreated moderate to severe sleep apnea have significantly elevated risk of hypertension. The repeated drops in oxygen and the sympathetic activation that accompanies each apnea event drive blood pressure chronically upward. The risk of cardiovascular disease, including heart attack and stroke, is meaningfully elevated. Cognitive function is impaired. The nightly fragmentation of sleep architecture prevents the restorative processes that the brain requires, with long-term implications for memory and executive function. Type 2 diabetes risk is increased through the effects of sleep disruption on insulin sensitivity. And virtually all of this is happening invisibly, silently, while the person sleeps, while the only external signal that something is wrong is that they wake up every morning with a dry mouth and feel inexplicably tired. If you wake up with dry mouth consistently, particularly if you also experience any combination of morning headaches, daytime fatigue despite adequate sleep time, difficulty concentrating, or if anyone has ever mentioned that you snore heavily or stop breathing during sleep, please talk to your doctor about a sleep study. A polysomnography or a home sleep test can diagnose sleep apnea definitively. And the treatment, CPAP therapy in most cases, positional therapy, or oral appliance therapy in milder cases, is highly effective. Patients who begin CPAP treatment for moderate to severe sleep apnea frequently describe it as transformative. They did not realize how poorly they had been sleeping for years until they began sleeping correctly. Cause number 3. Medications. This is the cause that most people never consider, and it is extremely common, particularly in adults over 50 who are taking one or more prescription medications regularly. Xerostomia, the medical term for dry mouth, is listed as a side effect for over 500 commonly prescribed medications. 500. The classes of drugs most commonly associated with significant dry mouth include antihistamines, which are taken by enormous numbers of people for allergies, antidepressants, particularly the older tricyclic antidepressants, but also many SSRIs, blood pressure medications including diuretics and certain calcium channel blockers, bladder medications used for overactive bladder, antipsychotic medications, muscle relaxants, and many over-the-counter sleep aids. The mechanism is that many of these medications have anticholinergic properties. They block the neurotransmitter acetylcholine, which is responsible for stimulating saliva production, among many other functions. The result is that saliva production is chronically reduced, and the reduction is most apparent in the morning after the drug has been active through the night. This matters for 2 reasons. First, if a medication you are taking is causing your dry mouth, your doctor may be able to adjust the dose, change the timing of when you take it, or in some cases, switch you to an alternative that causes less xerostomia. This is a conversation worth having. Second, chronic medication-induced dry mouth has real oral health consequences. Saliva is protective. Without adequate saliva, tooth decay accelerates, oral infections become more likely, and the soft tissue of the mouth is more vulnerable to irritation and injury. Do not stop taking prescribed medications because you suspect they are causing dry mouth. Talk to your doctor. But do talk to your doctor, because this is a quality of life issue with a real solution in many cases. Cause number 4, dehydration. This one seems obvious, but it is more nuanced than it appears, and I want to explain why because the obvious version, drink more water, while correct, misses something important. Yes, inadequate fluid intake through the day means your body enters sleep already behind on hydration, and 8 hours of reduced saliva production on top of an already dehydrated state produces significant morning dry mouth. Drinking more water through the day is the correction, and it is a real and immediate correction. But here is the nuance. There are reasons people become chronically mildly dehydrated that are themselves worth addressing. Excessive caffeine consumption is a mild diuretic. It increases urine output modestly and can contribute to a negative fluid balance over the course of a day. Alcohol consumption, particularly in the evening, is a more significant diuretic and is a common cause of morning dry mouth that people sometimes attribute to the alcohol itself rather than to the dehydration it causes. High-sodium dietary intake increases the body's water demand and can contribute to chronic mild dehydration even in people who drink reasonable amounts of water, because the kidneys require more water to excrete excess sodium. And certain underlying medical conditions, diabetes being the most significant, cause increased urination and chronic dehydration as a symptom, which brings me to the cause I want to discuss last. Cause number 5, undiagnosed or poorly controlled diabetes. Morning dry mouth is a recognized early symptom of both type 1 and type 2 diabetes, and it is one that is frequently dismissed or overlooked for months or years before the underlying condition is identified. The mechanism has two components. First, elevated blood glucose draws water out of tissues through osmosis. The body attempts to dilute the excess glucose in the bloodstream by pulling fluid from surrounding tissues, including the salivary glands and the oral mucosa. This creates genuine tissue dehydration and reduces saliva production. Second, the kidneys respond to elevated blood glucose by excreting the excess sugar in urine. But excreting sugar requires water, so glucose excretion drives increased urine output, which drives overall dehydration, which compounds the oral dryness. The classic triad of undiagnosed diabetes symptoms is increased thirst, increased urination, and unexplained fatigue. Morning dry mouth and persistent thirst that does not fully resolve with drinking are part of this picture. If your morning dry mouth is accompanied by any of the following: unexplained weight loss, frequent urination particularly at night, unusual fatigue, blurred vision, slow healing of cuts or bruises, frequent infections, please see your doctor and ask specifically about blood glucose testing. A fasting blood glucose test and a hemoglobin A1C test will tell you and your doctor what your blood sugar regulation looks like over time. Type 2 diabetes is frequently asymptomatic in its early stages, which is exactly why it goes undiagnosed for an average of 7 years before detection. Morning dry mouth, in some cases, is the earliest symptom that brings people in for evaluation. If catching it early leads to a diabetes diagnosis at a manageable stage rather than a late stage, that morning dry mouth will have done you an enormous favor. Now let me give you practical steps, things you can do starting tonight. Sleep position matters. Sleeping on your back makes mouth breathing and airway collapse more likely. If you are not already a side sleeper, experimenting with side sleeping, using a body pillow to maintain the position if needed, can reduce both mouth breathing and apnea events. Nasal breathing support. If nasal congestion is contributing to your mouth breathing, addressing it before sleep with saline nasal rinse, appropriate allergy medication if relevant, or nasal strips can meaningfully reduce the degree to which you breathe through your mouth overnight. Hydration timing. Drinking water consistently through the afternoon and early evening, not a large amount immediately before bed, which disrupts sleep with urination, but consistent hydration through the day, ensures you begin sleep with adequate tissue hydration. Reduce or eliminate alcohol in the evening. Even moderate alcohol consumption several hours before sleep causes measurable dehydration by sleep onset. This is one of the most common and most correctable contributors to morning dry mouth. Reduce caffeine after early afternoon. Caffeine's half-life is approximately 5 to 6 hours, which means caffeine consumed at 3 in the afternoon is still 50% active at 8 or 9 at night, affecting both sleep quality and contributing to mild fluid loss. Humidification. If you live in a dry climate or run heating or air conditioning that reduces indoor humidity, a bedroom humidifier can meaningfully reduce the drying effect of breathing dry air through the night. Review your medications with your doctor. If you take any of the medication classes I mentioned, ask specifically whether dry mouth is a known side effect and whether there are alternatives or adjustments available. And if you have been waking up with dry mouth consistently for more than a few weeks, particularly if it is accompanied by any of the other symptoms I described: fatigue, thirst, frequent urination, snoring, morning headaches, please make an appointment and describe what you are experiencing specifically and in detail. Morning dry mouth is not a complaint that most people bring to a doctor. It should be. Your body communicates in the language of symptoms. The symptoms it uses in the early stages of developing problems are frequently subtle, easy to dismiss, easy to normalize, easy to accommodate rather than investigate. Morning dry mouth is exactly that kind of symptom, small enough to ignore, consistent enough, if you pay attention to it, to tell you something real. The difference between the patients I have seen who caught something early and the ones who caught it late is almost never that one group was sicker and one group was healthier to begin with. It is almost always that one group paid attention to small signals and one group did not. You are paying attention now. That is the beginning of everything. I am Dr. Clarence Martin. If this was useful to you, please share it with someone in your life who has been dismissing this symptom the way most people do. Subscribe for more content that takes everyday symptoms seriously and explains them with the honesty they deserve. Take care of yourselves.